There's so much going around about weight loss right now, a lot of information, and we try to stay on the forefront of everything that's current. We are always looking at things coming out, and I just love to offer for my patients just what is best right now and what gives the most effect for patients, meaning that we're not just looking at weight loss. We are also looking at well-being. We're also looking at mental clarity. We're also looking at the bones and such like that. And we're really excited to share a fascinating insight about our weight loss program, and it goes beyond just shedding pounds. And our approach is going to extend to encompass holistic wellness, and that's going to tap into the body's innate mechanisms for gradual and sustainable weight loss. And that's also going to give the addition of enhanced sleep quality, anti-aging, and enhanced skin elasticity, and just a more youthful feeling of well-being. And the other things that we're really going to concentrate on are your cognitive functions. We want to really concentrate on memory retention and the reduction of mental fog that can happen with age as well, as boost those energy levels. And in the meantime, we are going to burn fat. So the way that we are doing that at AAG is we are actually encompassing a couple of different medications. The one that I'm going to highlight today is our Sermorelin. The Sermorelin is one that makes people a little bit nervous when they hear the term growth hormone. And this is not a growth hormone. This is actually stimulating the pituitary, which makes the growth hormone. And growth hormone is something that naturally declines with age, and it's something that is in charge of collagen production, is in charge of keeping us young. And so once that starts to decline, that's when we start to see like the changes in our sleep cycles, the changes in our bone density, the changes in our skin elasticity, and our ability to build muscle, as well as our ability to lose fat. And so what we're doing is we're giving the pituitary gland a little ping. And the Sermorelin, the half-life for the injectable is only about 5 to 10 minutes. And what it does is it goes up to the pituitary, it gives a little bit of a ping to create a little bit of growth factor, and then it's done. It's out of your system. The beautiful thing about it is that the pituitary gland is very self-protective. And so the pituitary gland will not produce more than it's able or than it wants to. So it's only going to produce the amount that you produced when you were younger. And so when you're talking about the risk for cancer, when you're talking about growth hormones and stuff, that's when you're really giving true growth hormones. And that's giving an overabundance of what the body would actually make on its own. And so this is a more natural process that we're just pinging it to create what it would normally create when we were younger, so that our body functions just sort of resume to what they were when we were younger. And so a lot of people are just feeling a great increase in their feeling of well-being, their improvement in recovery from exercising. They're able to lift more, they're able to exercise more, they're able to burn that fat and improve that energy. And the goal of this is that we are working with you with nutrition and with exercise, so that when you start to come off of this, your body's adjusted, your body is ready. And so when we are towards that year mark, we can start reducing what your whatever dosages you are on. And so we can start cutting that down so that you can start taking that over by your lifestyle. Generally, we see on week 1, we see an improvement of your quality of sleep. We also see on week 2 a faster recovery from your workouts. From week 4, we're really seeing that increase in mental clarity. In week 6, that increased skin elasticity. And by week 8, those changes in body composition. So that is a slower process than what we're looking at when we're doing things with Mounjaro, with Ozempic, with Wegovy, okay? When you are using a GLP-1, which is what those are, it's a semaglutide, that is causing a forced weight loss, okay? And so what's been happening in the world of weight loss, and the reason that I become concerned as a provider, is that it's being used for people that it's not appropriate for. So it really needs to be used for people with a BMI above 30 or above 27 with comorbidities, meaning that you have high cholesterol, you have high blood pressure, you have other things going on that are related to weight gain. Those are the people that are really needing this medication, because we really need to get the weight off quickly. We need to get the weight off quickly because you're starting to have negative effects in your body due to the weight gain. The problem becomes when you're using it when you do not fit that criteria. When you do not fit that criteria, it's going to cause a forced weight loss. So it's non-discriminating as far as where it's going to take from. It's going to take where it's easiest. That's when you're seeing things like, if you look up Ozempic butts, where people are losing their whole backsides, because that's where it's easiest to come off of, because they don't have the weight to pull from. The difference with Sermorelin is that you're not seeing changes in body composition until at least 8 weeks. That seems like a long time for some people, but that's because it is a more natural, sustainable, non-forced weight loss. So studies have shown that at the end of year 1, you have a 20% overall reduction in your overall body mass, okay? And 20% of that is in the extremities, and 80% of that is exactly where we want, in that mid-abdominal region. And so that is why we're really loving this, because it's not only just handling the weight loss, it is handling so much more as far as our well-being and our feelings of well-being. So that is why we are very excited to have our patients on Sermorelin. Everybody has been extremely happy with it, and I have honestly been amazed at the results. We've had a lot of patients that they start seeing the body composition changes a lot sooner than we would project. And the thing is with this is that this is going to help us to build muscle, which that declines with age. So what we see happening is that it's replacing that fat with muscle, which is what we want. But you have to keep in mind that muscle, it really weighs more than fat, okay? So we're not just going by the scale. We're going by how your clothes fit. We're going by how you feel. We're going we're going with the tightness that you're feeling in your body, the skin changes, and the overall changes that way. So it's a lot more than just dropping the pounds, dropping the pounds, dropping the pounds. This is an overall quality of life. And so we're very excited to offer this, and we work with our patients. We have someone that is working with you weekly as a nutritionist and a personal trainer. And then I or my nurse, we are seeing patients monthly and checking in, seeing how you're doing, adjusting dosages. And it's a really great relationship that we have with our patients. And so I invite you to come and to have a consult with us, and we sit down and we look at your labs, we look at your lifestyle, we look and see if this is actually a very good fit for you. Because once we find that fit for you, the results have just been phenomenal.